Now we shall be learning the chapter of first aid in common medical emergencies, the aim of which is to acquaint a cadet about medical emergencies and a basic first aid given to an injured person. We shall be learning this under following heads, that are Introduction and Overview, various medical conditions and their treatment, conclusion, that will be followed by a quiz to test your presence. First aid is an emergency care given to an injured person until a full medical treatment is available to him. Basically, the first aid is primary assistance given to an injured person or victim whenever his injury or illness is serious or minor. Various injuries, their recognition and treatment will be dealing them in detail. The first in order is internal injuries. These injuries are those type of injuries that can be not seen outside but can only be suspected. These injuries will be suspected by their symptoms. The symptoms of internal injury can be if a person is having cold or clammy skin, that is, if he is excessively sweating. The second is if a person is having weak or rapid pulse. If the person is having shallow breathing or sighing is also a sign of internal injury. If the person's face is pinched or pale, eyes are deeply sunken and there are dark circles witnessed around them. Patient usually becomes restless and anxious and may lose his consciousness. The screen is showing you now the internal organs flowchart where internal injuries are very common. To start with, there is brain where a brain hemorrhage can take place. Then the following organs are pharynx, larynx, lymph nodes, heart, lungs, muscles, arteries, spleen, which can be injured as ruptured spleen, liver, gallbladder, stomach, bone marrow, kidneys, skeleton, veins, pancreas, urinary bladder, and intestines. The recognition of internal injuries can be if we see a person or a victim having trouble in breathing, is having shallow sighing, tenderness at site of injury is witnessed, if the chest of the person is deformed or bruised, if the pain is if a person is having pain in movement, if the bleeding is seen in his coughing, crackling feeling upon touching victim's skin. The treatment of internal injuries can be of two types, that is the primary treatment and the secondary treatment. For the primary treatment, call immediately for an ambulance and assist the victim to a position of rest. In the secondary survey, monitor the patient's condition carefully, be vigilant and keep alert for any changes. If a flail segment is suspected, tightly secure with a bulky dressing. In the screen, you can see a person is first aid for an internal injury. Burns and scalds are the next type of injuries we will be learning. Burns and scalds can be caused by heat or chemical fluids, which can be of three types. First one is dry contact with fire or flame. Next is wet scalds by hot water or hot fluids. Generally, the blisters are caused due to it. Third is chemical burns, which may be caused by chemicals like chemical acids like sulfuric acid or hydrochloric acid and alkalis like ammonia or lime. In the screen, you can see a skin burn treatment and do's and don'ts of it. You should hold your hand under cold running water, use an antiseptic ointment after that, make cool compress at the injured area, take OTC pain reliever, Apply aloe vera juice. For the first aid treatment, if the burn is chemical, let the water flow freely on the burn. Protect the burnt area by applying a bandage or cover it with a clean towel or cloth. Give complete rest to the patient. Reassure that the patient is positive. Evacuate the patient to the medical help immediately. In case of snake bite, the snake bite is the poison injected by a snake, generally the snake being a venomous snake. Such kinds of snake are vipers, cobras, etc. The snake, through a pair of hollow and deeply grooved biting fangs, may cause you the injury. The majority of bites occur on parts of limbs which are exposed, like lower legs, feet, and hands. First aid treatment for a snake bite is: make the victim lie down comfortably. Give convincing reassurance against fear of death. Apply a light constricting turquoise with handkerchief, bandage or shoelace above the knee for a bite on the leg and above the elbow for the bite on the arm, so that the poison does not spread to the full body. Wash with soap and water and use water freely. Evacuate the patient quickly to the nearest dispensary or hospital. If the breathing of the patient is failing, then start artificial respiration. In the case of scorpion bite, the scorpion bite injury is generally wounded a person when a stinger of scorpion followed in a scorpion's tail is bitten. Bite by scorpion should be treated like a snake bite. First aid treatment for a snake bite is: if the blood has been drawn, the wound should be cleaned well with antiseptic lotion. Evacuate casualty to the nearest dispensary or hospital. Next in order is rabid dog bite. Rabid is a very dangerous dog bite transmitted diseases by a rabid dog. The disease is preventable by giving anti-rabies vaccine to the injured person. In the screen, you can see the progression of rabies virus which enters the tissue of a person from the saliva of biting animal, which replicates in nearby muscle, which moves up then to the peripheral nervous system to central nervous system. Virus then ascends to the spinal cord and reaches to brain and causes fatal disease. Virus enters salivary glands and other organs of victim. The first aid treatment for a rabid dog injured person is: immediately wash the bite area with lots of water and soap. Wound should be cleaned with available antiseptic. Patient should be sent to the nearest hospital for an anti-rabies injection course. Dog and the patient should be kept under observation for at least 10 days so any casualty further occurred can be noted. Asphyxia is an injury that is caused when the wind obstruction is occurred in a human body. Anything which interferes with respiration, producing irregularities in breathing, produces a condition known as asphyxia. Causes of asphyxia may be drowning due to which water enters air passage, hanging or strangulation due to obstruction of entry of air, suffocation due to obstruction in air passage, and foreign body obstruction. It can also be caused by inhalation of poisonous gases like carbon monoxide. The next is the dosage of drugs like sleeping pills, morphine, pethidine can also cause asphyxia. Electric shocks and diseases like tetanus, epilepsy and rabies can also be its carriers. For the treatment of asphyxia, first of all, remove the cause if possible. Ensure that there is a free passage for air. Lay the individual on his back. Press the head backwards, supporting the neck on your palm. Lift the tongue clear of the airway and give mouth-to-mouth breathing if necessary. Signs and symptoms of asphyxia noted in a person can be if a person is feeling dizzy or he is feeling weak, shortness of breath rate or breathing increases. There can be noted rapid pulse in the body of person, partial loss of consciousness, swelling on the veins of the neck increases, face, lips, nails, fingers and toes may turn blue. First aid for strangulation or hanging. Cut the constriction if possible. Clear the air passage of the victim. Start artificial respiration to the injured person. Give inhalations if possible and make the patient warm and comfortable. First aid for choking. Bend the casualty's head and shoulders forward to dislodge the obstructions. In case of small child, hold him upside down and thump his backward between the shoulders and encourage vomiting by passing 2 fingers to the back of the throat. Suffocation by poisonous gas is also a serious injury. Protect yourself and remove the casualty from gas as early as possible. First aid for electric shock. First of all, switch off or break the current if possible. Remove the casualty from contact with the current if possible. Stand on some insulating material such as rubber, soled shoes or boots, or piles of newspapers or any wooden material. Give artificial respiration if needed. Treat for shock and burns. Insensibility or unconsciousness. Insensibility for unconsciousness is caused due to the following: interruption of action of the brain through some interference with the function of central nervous system. Causes of unconsciousness, also known as coma, may be head injury or brain hemorrhage if the person is suffering from hypoglycemia, if the person is having heart failure. Physical agents such as heat strokes or electric shocks may also cause unconsciousness or coma to the patient. And epilepsy is the next which can cause unconsciousness or coma. General rules of first aid in casualties of unconsciousness are: make the patient lie down with head turned to one side and pull out his tongue. Loosen the clothing the person is wearing and ensure the fresh air to let in. If breathing has stopped or is irregular, start artificial respiration immediately. Keep the air passage clear. Nothing should be given by mouth. Remove false teeth, if any, so that no obstruction of air is caused. Artificial respiration. If there is any irregularity in breathing or cardiac arrest is occurred, artificial respiration is given. If it is given correctly and in time, the patient's life can be saved. The next in order is mouth-to-mouth respiration. This is the most common and simple method. If given immediately and timely, it can save many lives. This can be given by following way. The ways are: casualty should be supine position, clean the mouth and throat to maintain air passage, extend the neck to straighten the air passages, cover the patient's mouth with clean gauze and blow directly or slowly into it for about 10 to 12 minutes. 7 steps of cardiopulmonary resuscitation are: first, put the heel of your dominant head at the center of person's chest. Second is put your other hand over your dominant hand, then interlock your fingers. Third is start chest compressions. Fourth is open the person's mouth. Add a rescue breath. Watch the chest fall. Then do another rescue breath. Continue the 30 compressions in 2 breath cycles. The step-by-step CPR process can be seen in your screens. First of all, shake and shout. Second is call for an ambulance. Third is check the person's breathing. Fourth is place your hand at the center of their chest. Fifth is push hard and fast about twice per second. Next is if you have had repeat cycles of 30 pushes and 2 rescue breaths can also be done. Wounds can be defined as a break in continuity of skin or muscles membrane. If it is caused, it can be caused by violence or such activities. There are mainly 4 types of wounds. First is inside wound. Second is lacerated wound. Next is open wound, also called punctured wound. Last one is closed wound or contusion. In the screen you can see the types of wound, which are closed wound, open wound and inside wounds. Open wound is the first in order. Open wounds can be classified according to the object that causes the wound. There can be 3 reasons when the open wounds are caused. First is incision or incised wounds caused by a clean, sharp-edged object such as a knife, a razor or glass splinter. Second is lacerations that are irregular tear-like wounds caused by some blunt trauma. Next is aberrations, also known as grazes, superficial wounds in which the topmost layer of the skin, which is the epidermis, is scraped off. Next is avulsions. These injuries is in which a body structure is forcibly detached from its normal point of insertion, a type of amputation where the extremity is pulled off rather than cut off. Next is punctured wounds. These wounds are caused by an object puncturing the skin, such as a splinter or nail needle. Penetration wounds are caused by the object such as knife entering and coming out from the skin. The last wound is the wounds caused by a bullet or similar projectile driving into or through the body. There may be 2 wounds of such kind, that is, one at the site of entry and one at the site of exit, generally referred to as through and through. Closed wound or contusion. A closed wound is an injury or a bruise in which some of the tissues or a part is irregularly torn or ruptured, but the skin may not be broken. It is caused by a blow or blunt instrument. First aid for such wounds can be given as follows. The first is place the patient in a comfortable position and reassure that he is positive. Next is stop the bleeding, if any, in the patient. Remove any foreign body that has pricked or entered into the patient's body if it is easily visible and can be easily removed. Do not force the removal. Prevent the entry of germs by applying sterilized dressing like first field or shell dressing. Give rest to the injured person and part by sling. Immobilize the part if wound is large or complicated by fracture. Treat the person out of shock. Send the patient to the nearest hospital or dispensary. Procedure of dressing of the wound shall be now taken up by us. The procedure is, if the wound is to be cleaned with antiseptic lotion and covered with cotton or gauze piece that is clean and of medication before applying the bandage. The aim of dressing of wounds shall be strictly kept in mind to ensure there is no septic occurring. These are to protect the wound from infection, reduce the swelling and early healing takes place, to support the affected part, to enable the individual to carry out his day-to-day routine fairly, and stop the bleeding. Reassure the patient and place him in comfortable position. Stop the bleeding and remove any foreign body. Clean the wound with antiseptic lotion and cotton. Apply antiseptic ointment or powder and cover it with a gauze. Articles required for dressing of wounds are antiseptic lotion, cotton, gauze piece, gloves, scissors, surgical tape, bandage, band-aid, and antiseptic powder. The first aid is the assistance given to any person suffering a sudden illness or injury with care provided to preserve his life, prevent the condition from worsening, and promote recovery. NCC cadets, by virtue of their routine, are prone to injuries and hence must possess the basic knowledge of first aid in common medical emergencies, and also give this knowledge to their fellow cadets or friends in school or home. Now we shall be doing a quiz for your assessment. You can see your questions in your screen. The first question is, what is the meaning of first aid? The next is, what are general emergency situations when a cadet needs to give first aid? Third is, what first aid to be given to a burnt patient? Next is, what first aid is to be given to a rabid dog bite case? And the last is, what first aid is given to a snake bite patient? Please assess yourself by answering these questions. Thank you. Jai Hind.